Namaste and good morning. Welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Namaste. We began last week with the problems and the difficulties of the female body. So today we have three topics. Fibroid, uterus, perhaps we could begin with that one.
See, fibroid is a tumor-like growth in uterus.
I see.
It can be like in the muscle body of the uterus, or it can be just below the mucosa, submucosal fibroid. Fibroid is basically a benign condition and very common. Almost
Very common.
35% of females have fibroids in their lifetime. And they are most harmless tumors. So unless there is some complication like excessive bleeding and all, we don't need to intervene in it. Nor it disturbs the pregnancy if it is of moderate size. And one female can have even multiple fibroids. The exact cause is not known. But must be under some delusion, body allows this sort of accumulation of tissues in the form of tumor. And homeopathy has wonderful remedies. We have seen that generally if it is only a fibroid and which is a silent and which doesn't cause any problem to the female, we don't intervene. But we have seen cases where we have treated the person on the basis of totality for some other acute totality, and again the chronic miasmatic background, and the fibroids have receded, regressed in size. But it is well known fact that after menopause, the females, the system gets rid of fibroids, and fibroids just disintegrate after the menopause.
The body clears them away.
Yes, it's a physiological phenomenon. So we have seen a number of cases. However, in conventional system, any fibroid means the gynecologist would suggest hysterectomy if the female has already have children, and then they would suggest hysterectomy, but actually it is most unwarranted thing. Sometimes, depending upon the position of the fibroid, if it is a subserous fibroid or if it is of huge size, even up to, like we have seen fibroids up to the size of say 6 centimeters. In such cases, there would be some sort of excessive bleeding during menstruation, and that giving rise to loss of blood. But that also can be remedied with homeopathic remedies. The complications of fibroid definitely can be overcome by giving ordinary remedies for fibroid. Like Phytoleca is one plant which is known to help in tumor. So Thuja, Phytoleca, these are the plants which in potentized, of course, form in homeopathy, they help. But as such, fibroids don't require any treatment, and fibroids don't cause any issue even with a pregnancy. We have seen a huge fibroid noticed only when the female was subjected to sonography after her conception. And everyone was apprehensive and nothing happened. The whole pregnancy was uneventful and she delivered a normal baby in spite of having huge fibroid. The fibroid as such is not a serious pathology, and it should be taken as of course it is not normal to have fibroid, but at the same time there would be no harm. Body knows how to live with it.
So you would rule out hysterectomy completely?
We never encourage hysterectomy for fibroid.
For fibroid.
Fibroid.
Thank you very much.